Hi, I'm Benjamin, CEO and Executive Director of International Cancer Specialists, or ICS, a medical oncology practice headquartered in Singapore and present in Vietnam and Indonesia. At ICS, our vision is unique and laser-focused, and that is to remove the fear of cancer and enrich the lives of 100 million patients from Singapore and around the world. We aim to achieve this vision by offering the most effective screening, treatment and support services at the most cost-effective prices in the most accessible manner. ICS also stands for integrity, competence and service, and these principles guide us in everything that we do, be it for our patients, our colleagues or our external stakeholders. One interesting fact from our history is that I actually started the company together with my mother, Mrs. C.E. Tan, who is apparently a legend in the private healthcare industry in Southeast Asia, back in 2008. I became CEO and Executive Director in 2016, when we became 100% owners of ICS. Before that, I spent several years learning the ropes by working on healthcare projects in Singapore and the region, as well as running a GP clinic. I'm also the founder of Benjamin & Joseph, a medical bill audit startup that ensures the integrity of medical bills for healthcare payers in the region and around the world. The burden of cancer is increasingly straining the physical, mental and financial health of millions of people in Singapore and around the world. ICS sees itself as a partner and not a competitor to the public healthcare system in providing more options not just for cancer treatment, but in the vitally important area of early detection as well. We believe that together, we can save more lives. Our experience together with the SMU-X Accounting Analytics Capstone project was a very interesting one, in which we worked with two groups of students in order to solve one of our most pressing issues that we faced in our recent years of growth. In a nutshell, we were trying to understand how to fulfill our vision for growth in Singapore, Indonesia and Vietnam in a sustainable manner for the long term. For example, how many doctors and nurses will be optimal based on expected levels of growth? How much should we be expanding our facilities overseas to balance both growth and sustainability? Should we be prioritizing growth over profit margins or seek to maintain current levels? We were able to gain better insights on how best to plan for our growth based on the database insights and bird's eye view provided by the analysis. There were two groups of students that we worked with closely throughout the project. Group 1 provided predictive analysis based on our requirements, while Group 2 provided forecasting analysis as well as the tools required based on our requirements as well. For example, Group 2 provided us with a forecasting tool that helped us to reliably and consistently plan for our new doctors coming into our new centres in Indonesia, Vietnam and Singapore. These planning includes new compensation packages, as well as the optimum mix of doctors and nurses that we require in the next 2 to 3 years. With this forecasting tool, we are more confident of planning, managing, and even exceeding our expectations for the new centres in these 3 countries in the near future. So on behalf of everyone at International Cancer Specialists, I would like to thank the professors, the students, and of course the rest of the team at SMU for providing us this opportunity to work with the students and professors hand in hand to receive wonderful insights that will help us in our future expansion plans in Indonesia, Vietnam and Singapore. We wish SMU the very best.